hemoglobin anemia. So here you have to come and describe about the case presentation based on a patient who has anemia. So here you have to tell me about the multiple factorial of factors that causes etiological result, and then also you have to include about the causes as well, clinical impressions as well as the diagnosis, treatment, and also you should include the management group. Okay.
Case presentation: iron deficiency anemia. A clinical case study on iron deficiency anemia in any female patient. This presentation covers a diagnosis, etiological, pathophysiology and management, addressing one of the most common hematological disorder globally.
Patient details and presenting complaints. Patient identification: name MJ, age 25 years old, sex female, ethnicity African and American, occupation retail worker, primary complaints: persistent fatigue and generalized weakness, shortness of breath and excretion, progressive exercise intolerance. Additional symptoms: pale appearance, brittle hair and fingernails, intermediate dry throat.
Comprehensive patient history. Past medical history: peptic ulcer disease, diagnosed at age 21, managed with proton pump inhibitors. Chronic PPI, use can impair iron absorption. No recent bleeding episodes. Other medical condition: no history of chronic kidney disease, inflammatory bowel disease or celiac disease. Maternal history: mother had iron deficiency anemia during pregnancy, suggesting familial predisposition. Paternal history: controlled hypertension, otherwise healthy. Hereditary condition: no family history of inherited hematological disorder. Menstrual history: menstrual history, regular cycle prior to IUD placement 3 months ago. Since IUD significant menometrorrhagia, 9 to 10 days heavy flow clots, directly linked to worsening anemia symptoms. Obstetric history: nulliparous. Social history and lifestyle: dietary habits, vegetarian diet 3 years with limited iron-rich plant foods and inadequate vitamin C intake, and initial cravings. Report daily consumption of 2 to 3 trays of ice. Employment: full-time retail work, physical activity becoming difficult. Substance use: dense tobacco, alcohol or recreational drug use.
Clinical examination and vital signs. Normal temperature 98.8 degree Fahrenheit.
Mild tachycardia, heart rate 95 bpm. Normal respiratory rate 18. Normal blood pressure 110 per 70 mmHg. Systematic physical examination findings. General appearance: pale, fatigue, dysphenic with minimal activity. Cardiovascular system: mild tachycardia 95 bpm. Regular rhythm. Capillary refill prolonged 3 seconds. Abdominal examination: soft, non-tender, non-distender, normal bowel sounds, no organomechely or epigastric tenderness. Heat examination: head, normocephalic, eyes, pale conjunctives, oral cavity, pale membranes, atrophic glossitis, angular colitis, neck, no lymphadenopathy or JBD. Respiratory system: respiratory 18 at rest, increase with exertion, clear breath sound bilaterally. Intermediary and extremities: skin, generalized pallor, nails, cholangia, brittle nails, hair, dry, brittle, easily broken, extremities, no edema.
Laboratory investigation and diagnosis: complete blood count and iron studies. Laboratory parameters: patient value, reference range and the interpretation. Hemoglobin level: patient value 7.0 G by DL, reference range 12.0 to 16.0 G by DL. Interpretation: severely decreased. Hematocrit 21%, patient value, reference range 36 to 46%. Interpretation: severely decreased. Mean compulsory volume: patient value 68 FL, range reference 80 to 100 FL. Interpretation: microcytic. Meanwhile, Barker's plot: hemoglobin 22 Bg, patient value, reference range 27 to 31 Pg. Interpretation: transference saturation, patient value 15%, reference range 20 to 50%. Interpretation: low. serum ferritin, patient value 18 Ng by ml, reference range 15 to 150 Ng by ml, interpretations severally depleted stories, reticulocyte count, patient value 1.2%, reference range 0.5 to 2.5%, interpretation inappropriately normal, peripheral blood smear finding, microcytes peripheral blood smear finding, microcytosis, hypochronia, anisocytosis, occasional thrombocytosis. Diagnostic confirmation, iron deficiency anemia. Key diagnostic criteria: serve microcytic hypochronia anemia and depleted iron stores, low serum ions with elevated TIBC, low transform saturation, consistent clinical manifestation of peripheral